Happy Lunar New Year, everyone! Welcome to the Endocrine Alchemist blog, a light keeper's blueprint for higher consciousness, inner peace, and soul evolution. I'm Joyce Valencia, an endocrine nurse practitioner, Akashic record reader, and light keeper to your spiritual journey. Each episode invites new spiritual insights to level up your journey in stepping into alignment, promoting healing, and embodying your highest self. A couple updates today before we start. Now, as you may have noticed in my previous episode, 2025 was a year of being in construction, and not necessarily for just myself. One thing I emphasized for myself for the past 2 years is to be intentional with my energy. I can't be spreading myself thin despite my ambitions to tackle multiple projects. In the past year, I worked in the clinic as a nurse practitioner, but also assisted with my husband's acupuncture clinic, Thousand Hands Wellness. Doing anything more with my time and finances was not energetically clear to me. I triaged my priorities as far as social media content goes, and I am emphasizing the health of our acupuncture clinic. But also, I get to give Reiki within the acupuncture clinic, so it makes a lot of sense as a great hybrid for adjunct therapy. It's been really fun to see the clinic grow and to get back to in-person Reiki sessions. So for those of you who live in the San Jose and Cupertino area, you can check me out at thousandhandswellness.com. And so, onto the blog. Today's blog article is Holding Space, Navigating Disease with Holistic Health in Mind. Reina was a new patient with type 2 diabetes. I began the visit with the typical open-ended questions to establish care. Exploratory questions can be a blessing for listening therapy. My colleague, also a nurse practitioner, took the words right out of my mouth. Sometimes I'm the therapist. For those who don't know, the Hemoglobin A1c is an average measure of blood sugar levels for the past 3 months. Values above 6.5% involve an increased risk for complications related to diabetes. Reina reported that her sugars are usually well managed to an A1c less than 5.7%, but that she is going through problems. Nowadays, her A1c is elevated at 10.9%. With a look of uncertainty because this was a choice description to withhold information, I asked Reina, "Do you mind elaborating on your problems?" There are many reasons why someone might suppress information during a medical visit. Many times it can be that they don't want to be a burden, as though the problem was not relevant to the purpose of our appointment. Are her problems related to finances where enrolling into a patient assistance program could be of benefit? Is she having side effects of a medication, and can we consider stopping or lowering the dose? Did her circumstances change at home, making lifestyle difficult to manage? When approaching care, it is important to embrace a holistic perspective to gain a better understanding of the situation and to also do root cause analysis. In fact, the problem had nothing to do with these possibilities. Reina told me she was experiencing deep familial hardship involving 2 of her family members. Sometimes when our beloved children rise against us, and said children have not yet mastered the art of forgiveness, mothers have no choice but to demonstrate their own unconditional love while brokenhearted. This was happening simultaneously while mourning the loss of a loved one. Suffice it to say, she was having a hard time, and most of the root cause was psychological in nature. Anytime our nervous system experiences emotional arousal and negative emotions such as sadness, grief, anger, or anxiety, we have a higher level of cortisol in the body. The lower vibration of energy subsequently kickstarts what is known as the sympathetic nervous system, also known as the fight-flight-freeze system, where, if chronically dysregulated, you may have a risk of cardiovascular disease, including impaired glucose control, immune dysfunction, and major depression. Reina wiped back tears that continually flowed throughout our conversation. It was self-explanatory that her mourning for all of this was causing much of her exceptional hyperglycemia. I had the greatest compassion for this soul because of the similar experiences happening in my own life, but was mindful to ground myself with sovereign energy and to be of service. I was careful to maintain silence through all of this, not making it about me and allowing her to take up space to navigate, not just through the discussion to answer my question, but also to traverse her own emotional processing. She cried, and I mentally coached myself not to react, but to be the even keel she needed to move through her energy. Feeling better and more composed, she was readying herself to return to the topic of blood sugar. Prior to fully steering back the conversation, I said to her, Raina, I realized you had a choice to share some highly sensitive and personal information. That took a lot of courage. I want to take the time to thank you for trusting in me to hold that space for you. I made sure she had a psychiatrist and psychologist to help address her problems, to confirm that she had a social support system, and ensure she was not a danger to herself. I refined her treatment regimen. It was personalized to her current emotional well being, level of comprehension, and what she can handle for change. It is important to me to have the capacity to address her diabetes with holistic health in mind, which also included spiritual care. No matter how behind I was in my schedule and how many patients were waiting for me in the exam rooms, I took time to sit in the back office to use my energetic grounding techniques. I left my desk refreshed and ready to go on with my schedule. I feel that this was a great example of what it means to be acquainted with one's holistic health in order to provide holistic care to others. Not interrupting people with comments or reactions which signifies your own self-soothing, not talking at people to teach them how to change, not trying to psychoanalyze or therapize people, not losing patience or putting my ego into the conversation. Just caring. Caring for the invisible hardship that people hold. Caring about the emotional and spiritual well-being of the person, and caring about who this person is at the soul level. At the end of the day, it is not about Western conventional medicine, pharmaceuticals, or lab results. It is, however, about wholeness. If this blog article resonates with your inner world, consider signing up to my newsletter at joycevalencia.com. If you go to the website, there is a free offer to sign up for a free endocrine and chakra guidebook, which will also sign you up for the newsletter. And also, please consider subscribing on this platform as well. That's it for today, folks. Please remember that you are beautiful inside, outside, and at the soul level. Thanks for listening.